I'm Jama, and I have RSD. I started out with a sprain in my right wrist, and over time I developed more symptoms of swelling and pain and hypersensitivity to touch, to air, that went from my wrist to my elbow, to my shoulder, to like my shoulder blade into my back, into my neck. At the base of my head, I would get headaches that would run forward towards, like the pain out of my eye. I'm very sensitive to air conditioning and changes in weather. Activity, I can only do a little at a time.
So you're disabled? For how long?
It's been over a year and a half now, since everything started, and it's just changed my life. I can't do the things that I normally did. I don't work.
You have constant pain?
Constant pain.
Mm.
I never knew what it would be like to have pain every day, and every day I have pain.
And what kind of treatment have you had, and what are the results?
I've gone to pain specialists and orthopedic surgeons, and a hand specialist because it started in my hand, and just about everything they offered was drugs. Other tests to make sure that I was having the pain or to see what was causing the pain, but they can't identify what is causing my pain, which is frustrating because they say, well, here's a pill or here's a drug. I've been on Lyrica, and I believe it's called Celebrex, Neurontin, and then from there they just gave me pain medications, Vicodin and Percocet, and just a variety of pain medications, so they were never treating the cause. They felt that they couldn't find the cause of my pain, just treating the symptom.
So what's the point of specialization when everybody use pill anyway?
Everybody just used a pill anyways.
You had some acupuncture, so tell us about the experience.
I did start to have acupuncture. I got to a point where I was just having insomnia. I couldn't sleep. The pain was so bad. And they gave me another pill for that. And I took one and slept for 14 hours. And it wasn't restful sleep. It was just, I was drugged.
Yes.
After that, I told him no more drugs.
Yes.
I want to find something else, something that's going to heal me and not just the pain or the symptoms. So I sought out an acupuncturist who worked very well with me.
How many treatments?
I was doing treatments 2 to 3 times a week from August till about December. And I was starting to get better. I got pregnant, and a lot of my symptoms came back. I believe it was my hormones that were just causing everything to kind of fall out of place.
Your chi.
And my chi to fall out of place, yes.
That ruins the hormone. That dictates what hormone you do.
Well, yes, it made my hormones kind of go all over the place. And then my weight gain, plus from my pregnancy, I felt like that was adding more swelling on top of the swelling that I was already having.
So how come you don't go back to the acupuncturist that helped you?
I was just trying to look out for something else that was kind of acupuncture. I started back going to acupuncture, but I felt like there was a barrier there. Like I just couldn't break through. It was treating me. I only got to a certain point. And a friend of mine had seen Dr. Tong, and she suggested that I come in. Yeah,
my trick is the injection, but I'll show you my acupuncture would be better than the other person's. Okay, yeah.
Okay. I just finished my first treatment with Dr. Tong, and I feel amazing. I cannot believe what a difference I feel in just one treatment.
Acupuncture only?
Of just acupuncture. I've had acupuncture before, and never did I feel like this.
How many months do you have acupuncture before?
Months and months and months.
And how many treatments per week?
2 to 3 a week for months. I've never felt like this. I can't even explain. It's like
How much pain you have?
Little.
RSD.
Little, if any. And I never thought I'd feel like that.
Good.
I'm sorry.
Yeah, you need to explain to the other people what RSD is. It's very, very painful condition.
It's pain. It's pain every day. Every minute of every day. It's pain. And it's constantly thinking about a part of your body that you shouldn't have to think about. It's constantly there. Right now I feel...
Move your arms.
I feel overwhelmed. I feel overwhelmed because I haven't felt like this in over a year and a half, more than a year and a half.
And this is just acupuncture without the injection.
I need the injections
The
then.
injections even better. Yeah.
I need the injections because I feel there's such a difference. I feel like such a difference.
Yeah, move your arms. You weren't able to do that before, right?
It was hard and it hurt, but I just feel so different.
How about emotionally?
I feel relieved. I feel hopeful. Before I just felt like there wasn't a light at the end of the tunnel, and I feel like I've seen it.
Yeah.
Now I feel like I've seen it.
You feel like you are Jama.
I do.
See? This is exactly what I did for you.
I did.
I put Jama back into that body. Yeah.
I feel speechless. I feel so overwhelmed right now.
Yeah. You are an RN.
I am an RN.
Yeah.
And I have never heard of this, and I don't think I've ever seen a patient of mine experience this. And
So how did you find out about me?
a friend of mine who was also an RN who had some problems, and she said, you have to see Dr. Tong. And now
She came to see me, right?
she did see you. And she said, you have to go and see Dr. Tong because he will fix you. He will help you.
Yeah. So now you know it can be cured.
I do.
And they keep putting different label, RSD, what else do they call it?
Complex regional pain syndrome. And I know what I can call it. I can call it goodbye. Goodness. I do. I feel amazed. I feel amazed, and I feel shocked at how normal I feel right now. I didn't feel normal before.
How was it not normal before?
I just felt
Before.
pain. Before pain and